everybody, and thank you for joining me. Let me give you my apologies for starting a little bit late. We are in the John A. Wilson building to provide a situational update on an update on COVID-19. I'm joined by Dr. Nesbitt, the Director of DC Health, as well as Kevin Donahue, the City Administrator, and Chief Conti. And before we begin our normal update, I asked Chief Conti to come to provide a brief public safety update. Chief?
Thank you, Madam Mayor. So first I'd just like to bring everyone's attention to an incident that we had this morning. This morning before 4 o'clock a.m., members of the Metropolitan Police Department responded to the 4300 block of Connecticut Avenue Northwest. That location is where the Days Inn Hotel is located. Our officers responded there for a shooting. Once they arrived at the location, they located a female victim initially that was inside of the lobby of the hotel suffering from a gunshot wound. We later learned that there was a second female victim in one of the hotel rooms who was also suffering from a gunshot wound. Later on, 2 males showed up at area hospitals seeking treatment for gunshot wounds, and there was a third female that also had a non-life-threatening gunshot wound. Right now, we are investigating this case, and the pieces are starting to come together. It appears that this incident involved a situation where people are known to each other. Right now, we have persons who are cooperating with the Metropolitan Police Department, and we are hopeful to bring this case to closure very soon. The person who is deceased, we have not been able to make next of kin notification as of yet because the person's identity has not been confirmed. But once that identity is confirmed, we'll make notification to the family, and after notification to the family, obviously we will release that information to the public. At this point, we don't think that there's any immediate danger to the public. As a result of this incident, there was a weapon, at least one weapon has been recovered so far. Again, we're still in the very preliminary stages of the investigation. This happened very early this morning, but our detectives are working around the clock, and I'm very confident that we'll be able to bring this case to closure. Sam?
Like drug related or anything like that?
It's hard to say right now and exactly what led up to this. We know that there was a gathering of some individuals or some people inside of one of the rooms. These people legitimately, they came into the District of Columbia, it appears possibly from Maryland. They rented a room. It may have been some kind of just social interaction going on, and one thing led to another that resulted to the shooting. Unfortunately, we don't have all of the facts right now to be able to release to the public. But again, based upon what I know so far, we're moving very quickly to try to get this case wrapped up.
So these are regular customers. It wasn't like some kind of the city puts people up and things like that. No.
So at one point, the city we utilized that location for people who were needed to quarantine during COVID. However, this has nothing to do with anybody who's receiving District of Columbia services for COVID or anything like that. Mark?
Chief, was all the gunfire contained to the one hotel room, and was there an exchange of gunfire, do you know?
There's possibly an exchange of gunfire that we are, again, as we investigate, forensically look at all this stuff, we're trying to put the pieces together, Mark, so it'd be a little premature for me to go too far into it, but it's possible that happened. And again, at least one firearm has been recovered right now, and we're investigating, and again, we have people who are certainly cooperating, and we're just trying to get to the bottom of it.
It all contained to that one room?
The incident was pretty much contained right there to the room.
Thank you.
Yep.
Hey, Chief, so we've
Yes.
heard about community members who have complained about drug activity, including sales and use at the hotel. Can you discuss that, including maybe how many calls you've gotten to that address for complaints?
Yeah, so looking at that address, if we look back to July, I guess it was, there have been 73 calls for service, but all of those calls, I mean, it run the gamut. 18 calls for disorderly conduct, a couple of calls for investigate the trouble, some miscellaneous calls, check on the welfare, assaults, just a gambit of different calls. I think some of the drug complaints that were received were investigated. I don't know, not necessarily sure if this is as a result of sometimes people hanging out in front of the hotel. I personally have knowledge of that space there. I frequent the cleaners that's right there. So sometimes there are individuals that are hanging out like right there on Connecticut Avenue, and I'm very I believe that that's really kind of the source of it, like right there at the hotel. But just those were the list of the calls for service that we've had since July.
Thanks.
Is that high?
Say it again.
Go ahead, sorry.
Thanks. We also heard from the ANC chair in the area that they had heard a man had walked in off the street and entered the hotel and shot up the party. I don't know if that aligns with anything you've heard.
Well, I mean, certainly somebody went to the location, and again, there was a shooting. Again, we have to put those facts together to really try to understand better what exactly happened. I don't know if it was an invited person, but we have to work to get to the bottom of that. Steph?
If you're saying there's no threat to the community, does that mean that the suspects, whoever was shooting, that they are either in custody or in the hospital, that they are in possession of, or right now in police custody?
No, we think that that we have many of the people who were there, who were present at the time of the shooting. We know that, but there could be other things that evolve as a result of the investigation, but right now there does not appear to be an immediate public threat where we are setting up, we're setting up a perimeter and actively searching for someone in the immediate area right now.
And can you describe the firearm?
Handgun.
Were any bullets found to have gone through the room walls?
That gets into the evidence, so I won't really discuss that part. Mark?
Yeah, Chief, you talked about the 73 calls for service.
Yeah.
Has this location been determined to be a nuisance property because of the number of 911 calls for service?
I don't know that it's been determined to be a nuisance property. I know that our district commander there, Commander Bedleon, is certainly working with some of our other, partner agencies to bring attention to the issues that are causing the police to be called there. But I don't know if it's been determined, officially determined, whatever that means, to be a nuisance property. We've had 73 calls there for different things, disorderly and the like. But again, that's just kind of taken a snapshot in time from July to now to really report on those calls.
And can I just ask for you and for the mayor, we're at, I believe, 12 homicides so far this year, which is just maybe 2 shy this time last year. So we continue to see with this trend of more and more killings in the district like we saw last year. What do you say to residents, to both of you, who are losing confidence in your ability to slow down this trend?
Well, I would hope that people will certainly keep their confidence to slow down the trend, because we're doing absolutely everything that we possibly can. When you look at the homicides that have occurred today, again, inside of a hotel, a dispute between individuals. Prior to that, some of the other homicides I can think about, the case we just closed the other day on Georgia Avenue, a domestic case inside of a car. I mean, we see things like that happen. I think the issue is the availability of firearms to individuals, but beyond that, the way that people are choosing to resolve conflict in community. That's not something that's unique to the District of Columbia. That is an issue, and that's an issue that we must do everything that we possibly can. I'm going to arrest, I'm going to close cases, I'm going to do everything that I possibly can to bring individuals to justice. But I think that the issue goes beyond really, what the Metropolitan Police Department did or didn't do. It's really on the front end of these things, like how do we even find ourselves in this space to begin with? How do you explain a person who shot and killed a woman inside of a car in front of her children? How do you explain that, right? I mean, what government intervention might stop something like that from happening? I mean, if someone has an idea, I'm certainly open to those ideas, but I think it just speaks to where some of the people are in community. But more importantly, Mark, I think you bring up another very important point. It's the reason why we must be very focused as we talk about the collective ecosystem in our criminal justice system, why we have to be very much focused on making sure that people are not in community committing these types of crimes. When you look at our violent criminals, our homicide suspects, as an example, the average arrest number for homicide suspects is 11.3 arrests for homicide suspects, right? So these individuals are no stranger to our criminal justice system, but I think we have to really look differently in that space. And you've heard me talk all year, last year, about accountability. I'm not going to stop talking about that because it's an important issue, right? It is a very important issue. And when we talk about accountability, people move differently in that space, but that is an important piece of this when violent criminals are in our community. Chief Conte will do everything that he can to put bad guys in jail. I'll assure you of that. Yes, ma'am.
Chief, on that matter, there's a couple of other, crimes I'd like to ask you about. But
Yeah.
I do want to ask you about a couple of tips that Fox 5 have received, claiming that the suspect who was arrested for shooting an officer in D.C. this weekend, that person was actually in police custody, but due to some kind of issue of maybe a watch commander not being able to deal or wanting to deal with warrants at the time, that person was not arrested at the time, and arrested later. Can you kind of clarify?
Yeah, well, that's not totally accurate. Did we have contact with the person? I mean, as you know, this is a police shooting, so a lot of things are very quickly unfolding, and we didn't know exactly what we had at that point. That person was allowed to leave the location at some point. And subsequent to that, we applied for an arrest warrant and was able to make an arrest of the individual. I think the case is spelled out in the warrant for what he has been charged with, and I would just leave the facts there. I mean, anything else with respect to what happened in a chaotic scene involving a police shooting, certainly there are things that we will look at, but, I'm not ready to step out there to say, this person failed at their job. I'm just happy that this guy's off the street.
So was it known then when he was talked to that there was an open warrant?
No, that's not correct. No, we didn't know at that point. If someone knew it, I don't know, maybe there was someone that knew it, but based upon what we saw in the system, I don't think that there was an active warrant there. There was a warrant later on that was applied for, and you look at the date on that, there was a warrant that for escape that came out of, a valid warrant, I should say, that for escape that came out of Maryland for his escape status. But there's a lot of unknowns that we're looking into, obviously, but some of this would be pure speculation as to who did what. Like I said, the important thing I think we have to focus in on is that this guy who shot at our police officers, a warrant was signed by a D.C. Superior Court judge charging him with the firearm that was recovered, and he's been quickly taken off the street. Subsequent to that, a search warrant at the location where he was found revealed another 3 firearms that were picked up from that location. So we'll continue to work this case, and as other information unfold, we're still inviting the public to call in any information that they have related to this case.
Can you just clarify policy then, though, if the SWAT team goes in, they pull these people out, are they supposed to look at any open warrants against anyone in this jurisdiction?
Yeah, well, see, that's where some of the discrepancy comes in. It's not, at this point, we're not talking about the SWAT team necessarily pulling any person out. I mean, there were people who were coming out of the building. As an example, there was a mom who came out of the building who had an 11-month-old child alone inside of one of the apartments. So there were people, as a result of some of the police activity that was going on, coming out of the building. I mean, I'm not sure if you were on the scene, but I was there, and certainly it was a very chaotic scene. I think it's really kind of irrelevant to focus on, everything that happened in the moment of chaos. The important piece that we should be focusing on is that we have a violent person off the street who shot at one of our police officers. Next question. Okay, go ahead, next. You said some other crimes you wanted to talk about?
Yeah, we had a situation with teens.
Yes.
13 and 14.
Very unfortunate. Yeah, yesterday we had 2 15-year-olds and a 13-year-old that decided somehow these young people got a hold of firearms. They were firing firearms at each other in the area of New York Avenue and North Capitol Street. Thankfully, our police officers were in close proximity. We were able to recover 3 firearms. We were able to arrest these 3 juveniles. Again, another unfortunate situation. But how do you prevent those things from happening to begin with? I think we need to look at these young people, look at, follow these cases through the system. What's happening with that case this morning? Is it moving forward through the system this morning? And then after it moves forward from the point of papering, what's the next step in terms of what is their status? Are they back out in community? I mean, clearly there could be very well, and not prejudging, but perhaps there are some supervision issues if we have a 13-year-old out here in community with a gun. Where is that kid, after the 3 o'clock hour today? I think we have to look at that. When we talk about accountability, another thing that I've discussed over the course of the last year, we really have to focus in on following the breadcrumbs. So this young man, these 3 kids were arrested by the Metropolitan Police Department yesterday. They will go to court today. What is happening tomorrow with these young people? Next question.
Was this like cowboys or something? Were they playing with each other?
They're kids with guns.
Shooting at each other.
Shooting at each other. Yeah, that's reckless, right? I think we would all, right? I think we would all agree. A game. I wouldn't categorize this as a game because any one of those bullets could have hit anybody, my child, your child, whoever. And I think we have to look at it for the seriousness that it is, which brings up the question again. The Metropolitan Police Department arrested 3 kids, one 15, 2 15, one 13-year-old. Our kids. DC kids, we arrested them, recovered 3 firearms. They'll be presented in court today. What are the next steps that happen in the process? What happens with these kids? That's reckless behavior, right? And we can't condone reckless behavior. That's all I'm saying, Sam.
Well, I'm just saying the way you presented it, they were shooting at each other.
Yeah.
I was wondering, was this some sort of game that they were
No,
playing?
Sam, that's not uncommon. I mean, that might be uncommon to some people, but for people to shoot at each other, that is not uncommon. And I think it speaks to some of the violence that we see when we're talking about handguns in the hands of people who shouldn't have them. In this case, not the gun, but the illegal firearms in the hands of these, where does a 13-year-old get a firearm from? Where does 2 15-year-olds get firearms from? But, they go further to that, to even use them in broad daylight. That's unacceptable. And we got to make sure that there's a mechanism of accountability in place to ensure that that does not happen and that our citizens, our hardworking citizens who pay their taxes, who go to work every day, that they're not adversely impacted by the reckless behavior of a few in our community. Yes, ma'am.
Is there anything?
Last question. Yep.
That's the last question?
That's the
Last
last
question.
All right, I'm gonna ask then about, the carjackings.
Yeah.
Can you talk about where the task force is in that? How many, and is there any more behind what is fueling this, given that it looks like those numbers really haven't gone down?
Yeah, so let's go back kind of to the juvenile concern that I've just expressed with respect to the violent crime. So last year, the carjacking task force, in terms of number of arrests and all that the Metropolitan Police Department made, were 149 arrests for carjacking. 100 of those were juveniles. 100 were juveniles. 49 of them were carjacking. If we look at where we are so far this year, there have been 18 arrests for carjacking. 14 of those arrested so far are juveniles. So I think, certainly we have a direction in terms of where the issues and where the concerns are. The carjacking task force are very effective at what they do, but we have to look at the case beyond the point of arrest and see what is actually happening and what does that measure of accountability look like. I would dare say that the numbers are probably even greater than that because in some instances, in many instances, let's say if the carjacker is not arrested immediately, but that car is picked up later on tonight, for example, and the victim in a particular case is unable to specifically identify this person being the person who carjacked them. If that victim is unable to do that, that person would then be charged with unauthorized use of a vehicle, UUV, which is essentially a charge that most young people would be moved through our system. They would go from point of arrest and probably release. So again, I think that in these cases, these important cases, every case, as far as I'm concerned, when it happens in our community is important. We have to be very diligent about following those cases through the process to see where we need to make adjustments in the system. Right? If we have 149 people arrested, so it's not that arrests aren't being made. Where do we need to make adjustments in the system? Is it that they need more help, more assistance? I don't know. Is it that perhaps maybe this particular young person is not ready to be in community at this particular time, and we have to figure out some alternative for that young person? Thank you.
6 months in, are they selling this? Are they selling parts? Is there any information on more on what's fueling this?
I think it runs the gamut, to be honest with you. Some of them do it for fun. That's just because that's what they do. And I think that, I have young kids, and I know that when young kids feel like there's no consequences, a kid who carjacks somebody today, if there's no consequences for it, and consequence in the form of, hey, look, what's happening to my buddy who did A, B, and C, and I see my buddy back out in the community, that could be a problem. So I think that, again, we have to make sure that we kind of follow these cases through their course to see what the measure of accountability, what does that look like? Thank you for your question.
Thank you.
Yes, ma'am.
Thanks, Chief. And Chief, I know you probably have to get back to some things. We're going to turn to COVID, so feel free to get to them. And Dr. Nesbitt, actually, I'm going to go right to you. And we're going to have a quick briefing. You've had a moment to look at our presentation and answer any questions and start to formulate your questions. So Dr. Nesbitt is going to run through some data quickly.
Thank you, Madam Mayor. You all see before you our current COVID-19 key metrics that were released as of yesterday. I'll highlight a couple of them for you to give you a sense of how things are faring right now in the District of Columbia. Our weekly case rate, as reported yesterday, is currently 379.2. And it has been improving since we hit our surge during wave 4 as a result of the Omicron variant causing a significant surge in the District of Columbia. We had a peak in our weekly case rate toward the end of December, beginning of January, that caused our weekly case rate to be well over 2,000, around 2,460 or so. That's the highest it had ever been in the district since the beginning of our tracking of COVID-19. By comparison, our previous peak surge was in the winter surge of 2020, 2021. In early January of 2021, we hit a peak weekly case rate of around 352. So we have had a remarkable decrease in our weekly case rate recently. One of the fastest decreases in new cases and weekly case rate that has been seen nationally. However, we still remain slightly above the peak that we saw in our winter surge last year. So it's important for our residents to continue to remain vigilant, to continue to prioritize getting vaccinated, which we know is the best tool we have in our toolkit to protect us against COVID-19, and for those individuals who have been fully vaccinated to prioritize getting their booster dose. We've also had some progress in terms of our hospitalizations due to COVID-19. We've both seen a decrease, a week-to-week decrease in the proportion of individuals who have COVID-19 who are being hospitalized. That continues to improve over the last week, as well as the total number of people who are being hospitalized for COVID-19 continues to increase from week to week. So all of these metrics will continue to improve as our residents continue to pursue vaccination, as they continue to get boosted, as we recommend that everyone gets boosted. If you had Pfizer or Moderna, you should be getting boosted 5 months after you've had your second dose, and for J&J, you need to do that even sooner. And getting boosted with any of the vaccines, regardless of what your primary series is appropriate. So with that, I'll turn it back over to you, Madam Mayor, to highlight some of our community interventions.
You got it. We've been talking to you about our COVID centers that have opened, and I'm glad to see a lot of the amplification from press and members of the public to let people know where these centers are. And already, I think we are opened. Let me be clear about what has already opened. 1 second. The Ward 4 site that is going to be located at People's Congregational Church is opening today. Ward 3 site we continue to work on, so we'll give you a date for that soon. So we have centers open in 7 wards, and details on the Ward 3 site coming soon. We make available the hours of each of the sites, as you see on our website. So at those sites, remember that you can do the test yourself, PCR test. You can pick up antigen test if you're a DC resident. And beginning this Friday, you will also be able to pick up 2 free KN95 masks per day at any COVID center. So get you know what those look like, your KN95s that are recommended to be used. Tomorrow, we, with FEMA, in partnership with FEMA and the CDC, a new testing site will open in Ward 8. That's a 7-day-a-week site. It is located near the Anacostia Metro Station. So an additional site for PCR testing that's open 7 days a week at the cul-de-sac by Howard Road by the Anacostia Metro Station. We also have extended through the 15th our limited public health emergency. As you know, that is largely an administrative order that allows some flexibility for our hospital operations. So that will extend through February 15th. Our indoor mask requirements will extend through the end of February. We also want to remind individuals that of vaccine requirement reminders that began on January 15th. There are some dates that people need to meet by February 15th for their second dose. In March 1st, there's a reminder to all students that they should have their COVID-19 vaccine updated. By February 15th as well, all DC government employees must provide proof of their booster shot. Finally, just some general updates. We want to make this funding alert loud and clear. And so through the $40 million bridge fund, brick and mortar restaurants, retailers, and entertainment businesses still grappling with COVID can get emergency funds, grants up to $100,000 to cover rent, payroll, inventory, and operating expenses. The program will prioritize businesses that have not received federal relief funds and micro businesses with less than $2.5 million in revenue. Next, applications for the Summer Youth Employment Program begin tomorrow. So please, young people, ages 14 through 24, apply online at summerjobs.dc.gov, and applications will be open through February 28th. So with that, we'll take a few questions. Yes, sir.
Mayor, so is fully vaccinated now boosted for DC government employees?
Yes. For the vaccine requirement for DC government employees, they're required to have 3 shots.
Are we going to see this standard applied in other areas too, for the indoor vaccine mandate, or for students, for other groups?
I will have to refer to the council's legislation for students, because that is a council requirement. And someone remind me, for the indoor mask, for the vaccine mandate, does that include 3 shots?
No.
It doesn't at this time.
What was the sort of reasoning for moving forward requiring a booster as well for government employees?
Well, it's pretty clear. The evidence for having 3 shots in the face of Omicron have been pretty clear that people with 3 shots fared better than people who didn't have 3 shots. And we need our whole team in DC government to be available for themselves, their families, and of course for DC residents. Yes, sir.
Mayor, a question for Dr. Nesbitt.
Yep.
What you were telling us, basically, you're saying that right now, even though we've dropped significantly, we're still above the highest point last year. Did I hear that right?
That's correct, Sam.
So it's that bad. I mean, it was at this point. It got up to over 2,000, but even right now, we're still above the highest point last year.
Right. So I think it's important to always contextualize, right? So we've seen globally and nationally that the 4th wave, as folks have been referring to the surge in coronavirus or COVID-19 cases that have happened as a result of the Omicron variant, has caused a higher number of total cases that results in a higher weekly case rate than any previous surge or wave that we've seen. I want to contextualize what you mean by when you say bad, right? So there's a number of metrics that we've tracked or we've measured throughout COVID-19. What we know and what the evidence is beginning to make clear is that the severity of illness with Omicron is lower than it has been with other variants, for example, Delta, which drove the 3rd wave, what we experienced during the summer of 2021. That notwithstanding, there's a significant disruption to our society when there's a high number of cases. So when you think about it, and as the mayor has said, we need all of our workers to be able to come to work, to be able to be present to provide city services. We need all of our healthcare workers to be able to be in our healthcare facilities, providing services in our nursing homes, in our hospitals, in our primary care facilities. So when you have high rates of transmission and a highly transmissible variant like Omicron that spreads very rapidly through your community, causing high number of cases where people, even with minor illness, may have to isolate or they can quickly pass it to other people who may have more than just the sniffles, that can be extremely disruptive to the functions of a community and the functions of a society. So even though the number of deaths may not be as high, or what we call the case fatality rate may not be as high with Omicron, and the severity of illness may not be as high with Omicron, especially in communities that have high vaccination rates, you still don't want to have such high case counts at any point of time. So our surge right now has come down rapidly. That's a really good thing. But we're not as low as we have been at other parts of time, and we're still slightly higher than we were during our highest point of time last winter. The last thing I'll say is that winter months tend to be very difficult times for all respiratory viruses, like influenza or RSV, which is a virus that tends to impact young children. And so we always have to take care during the winter months to do things that help to reduce the spread of those respiratory viruses, which is, those washing our hands, staying home when we're sick, and increasing ventilation in crowded spaces also helps to reduce the spread of those respiratory viruses that tend to take hold of us during the winter months.
Mark, Michael, Stephanie, Jeanette.
I'm wondering why the difference in dates for the extension of the emergency and the extension of the mask mandate. Why are they not on the same dates, the same trajectory?
They don't have to be. They weren't instituted on the same dates either. And what we're looking at in terms of the public health emergency is the performance of the hospitals. And we've seen a very steady increase in their ability to serve people who are coming in those doors. So we're very hopeful that we won't need it beyond that.
Well, let me ask you that about the mask mandate.
The mask mandate, we're tracking a little bit closer to the indoor winter months. But we're going to see, even by the 28th of February, if conditions warrant, that may also not be necessary.
And then could I ask Dr. Nesbitt, according to the ABRA report on Big Board DC, on their investigation into Big Board DC, they indicate that Department of Health investigators also visited Big Board DC and found them in violation, but they were not clear, they were not able to put in their report any action that Department of Health may have taken against Big Board. Can you tell us anything?
I don't know, Mark, that we have an additional report on that, but I think you know that it is proceeding. Actions are proceeding at ABRA.
So Department of Health did not issue any fines or warnings?
I don't think so, but let's follow up and get you some info on that. Do you know that?
Our inspection reports are publicly available.
I think if there was a fine issued, it would have already been noted.
Thank you.
You got it. Michael?
Thanks. I want to follow up on Mark asked about the date for the mask mandate. Could you or Dr. Nesbitt talk a little bit more about that decision? Dr. Nesbitt noted, we're moving to the winter, getting through the winter months. Was that the main driver in extending that until the end of February? What else went into that calculation?
Do you want to add anything more? I mean, I don't think we have anything more to say about it.
Okay, what would be the barometer then if it's extended again? You mentioned cases are trending down, we're still high.
I don't know that it will be extended again, but we will look at where we are.
Okay, and then I wanted to ask you about the public health emergency in regards to hospitals.
Sure.
Were they afforded any other flexibilities besides being allowed to enable crisis standards of care?
I think that the orders that were issued, Dr. Nesbitt, would you go over the administrative orders that DC Health, I don't know what the word is, order put out?
Yes, sure. The Department of Health issued 3 administrative orders, which were consistent with administrative orders that were in effect through the previous public health emergencies that were in effect through July of 2021. Those 3 administrative orders had to do with crisis standards of care, reciprocity, essentially reciprocity for emergency medical services that will allow EMS providers to utilize their ambulances or providers who were duly licensed in other jurisdictions to operate in the district during the public health emergency. And the third one was related to liability. The liability is more so related to people acting, healthcare professionals acting as agents of the District of Columbia. So that would go into effect if we were to, as the District of Columbia, provide support for healthcare workers into a healthcare facility. One of the things that I think you all may be looking to better understand, and I'm making a gross assumption here, but we keep getting this question, so I'll try to add some clarity, Mark, is that the crisis standards of care is very broad in the district. And so what this does is it provides the hospitals with the opportunity to request from DC Health the ability to utilize spaces in their hospitals differently, so they may be providing inpatient services in places where patients would typically recover from surgery, or they may be asking for the ability to document healthcare services differently, that if we were subsequently coming in for a routine survey of their facilities or to investigate a complaint in their facilities, if they had done documentation differently during this period of time, they would not get a citation from us for it. Or if they were using some of their staff to provide services outside of their typical scope of practice, they would be permitted to do that during the crisis standards of care. And it's not only just for hospitals. When we're in a public health emergency, we give some of that to other service providers. So home health agencies can use certified nurse assistants as home health aides. Our long-term care facilities are using basic care aides to help augment some of their workforce challenges during this time as well.
Okay.
So I hope that's helpful for you.
It is helpful. So hospitals would, in essence, need to come to you all and request.
For some of those things, for some of the things, especially if they're using some of their hospital space differently, we have to be notified in advance about that.
Okay. Do you have a number of how many hospitals have been?
About 2 facilities have requested to operate differently during this time.
Okay, that's really helpful.
Mm-hmm.
Thank you.
Can you tell us which facilities?
I can get back to you on that.
And then has the Department of Health issued a waiver of liability? You mentioned.
No, we don't have to issue a waiver of liability. It is inferred if we place healthcare providers into a facility or if healthcare providers are working somewhere on the district's behalf to assist with any workforce challenges. And we have not placed healthcare workers into any facility, any healthcare facility, at anyone's request during this period of time.
Thank you.
Okay, Michael, you have
Thanks.
another
Yeah,
one?
I wanted to ask also about the government vaccine mandate. Can you talk about, I think the last I heard on this was you all were working with labor unions, so how did you come
Kevin,
up?
can you please, City Administrative Donahue is working across the district on this issue.
Thanks. See, I just wanted to ask, how did you all come up with this timeline for getting the shot and the discipline, and what were those negotiations like?
They were conversations, not negotiations, and we wanted to allow for them to be able to have knowledge of it, prepare their membership for it, and the two things we look at first is making sure there's enough time before the deadline kicks in for individuals to get their course of vaccinations. And the second one is to be able to allow for them to give feedback to us. Members who are not vaccinated and have chosen not to be, there's probably not a date or deadline that they're going to like. But we want the process to be fair and be one in which in which we listen to some of the feedback that they provide. So the date we provided was far enough, certainly since the initial announcement that we were going to have a vaccine requirement, to allow for individuals to be able to get the vaccine, particularly since we've now opened up COVID centers. It makes it easy in all 8 wards for individuals if they're trying to schedule an appointment at a pharmacy or supermarket to go to a COVID center to more quickly get the vaccine.
Thanks, and I'm sure you know I'm going to ask about the latest with the exemption.
I can afterwards give more detail, but I'll say at the top line, we have just under 1,000 religious exemption requests from employees across our department. Just under 250 have been ruled on and have been denied. The medical exemption requests are about 76. 15 have been, about 40 have been accepted for the medical exemption requests. The vast majority are still in process. And the thing I'll highlight for the process is that, the law really states you have to look at each one independently. So you can't really rule on a class. You have to be able to look at each exemption request for the uniqueness that it offers. And so that's time intensive in a process. So that's why when I'm up here, I like to report numbers. They don't move as dramatically as maybe some people think. We want to give due process to all of them.
Okay,
So if I could just follow, so could we get all the numbers? And I will just say, your staff, the last spreadsheet that they sent me was awesome. If we could get that on a regular basis,
I will.
super awesome.
It's a reflection of awesome staff, and I'll communicate that request to them.
Thank you.
one clarification, is the 1,000 cumulative, or is that the current number? I guess.
That's a good question. So that is the cumulative number. So that would include, when I say just under 250 have been ruled on and denied, that's 250 as part of that, just under 1,000.
Thank you, and then how many approved?
For the religious exemption requests, 1.
Okay.
And the medical exemptions have a higher approval rate.
Okay, thank you.
Okay.
Stephanie?
Mayor, I'd like to circle back on the big board situation and ABRA. There are some folks pointing out that no other businesses have really been fined for not requiring to show proof. Do you feel that this business, if they continue to flaunt the mandate, that they should be shut down, and do you think that will legally hold up?
I like the business to comply, and we don't want to shut anybody down. And that's how we've approached this throughout this 20-some months of this pandemic. We want to give people support, advice, supplies, help, whatever they need, but we do need them to follow the regulations.
And then a follow-up to that, if I may, just can you speak to folks who may feel that this is not exactly fair because it requires someone to actually report a violation, and then an ABRA investigator has to go and see this themselves in order for some action to be taken?
I don't know exactly what you're referring to.
In terms of if someone wants to keep, on one business and keep tracking every move they do, that's what will be reported versus another business in a city where nobody cares and everyone's continuing to do what they do. It's not getting to ABRA.
Well, we are going to be fair, and a lot of city services are based on complaints, but ABRA also is proactive in the work that they do. So they don't only respond to complaints. They are in and out of establishments nightly.
And then, just one more question on the boys that were shooting at one another. What do you want to see happen with those boys?
This is what I want to see happen with anybody who's using a gun in the city, and that is that the full extent of the law is applied, and that's what I want in the case of juveniles as well. We recognize in our city and most of our laws, and also how in a number of our agencies, we recognize that children are different, but a child shooting a gun is just as deadly as an adult shooting a gun. And so we have to be very serious about how we are rehabilitating that child. But consequences are important. I agree completely with what the chief said earlier. If the lesson that these children get and their friends get is that you can shoot guns and nothing happens, then people keep shooting guns. So we have to be serious about how we apply the law.
And just to follow up, I mean, Sam had asked the chief about this before. We understand the severity of this, but from the mindset of these young boys, was it that they were just messing around, playing in a way, even though we understand?
I really have no idea. I don't know, and I don't know that the chief knows. I can't put myself in the mind of somebody who picks up a gun and thinks that it's cute in any way. I don't know. I don't know if it was a dispute. I don't know if I really have no idea. But it almost doesn't matter. And I think that's what the chief was getting at. It doesn't matter. Like, I abhor the term joyride. Like, because we think because they're kids and they do something wrong, then there's something cute about it. So we come up with these cute words, but people can get hurt. And so it doesn't matter what it was about. It matters that 13-year-olds who should be supervised by an adult have a gun that's illegal, that they shouldn't have, and they're discharging it carelessly, recklessly, in a way that can kill somebody. That's what matters. Those are the facts that matter. Yes?
Yes, Mayor, and I don't know that you have anything to do with this, but the same thing has been talked about with carjackings, 13-year-olds or whatever, and the chief just said most of the carjacking people were arrested for it last year were juveniles. What I hear, and I haven't confirmed it, but what I hear is that they're picked up today and let go tomorrow. And if you got a gun in a situation like this, you think it would be more serious. Is there anything you can say or do that might influence the situation?
Yes, and I think we all can say and do something to influence, because everybody, rightly so, when they hear this or they see this, or unfortunately if they're a victim of it, they're blood mad about it. But when all the ecosystem that supports public safety is changed or altered or defunded, people are less angry about it. So we have to be focused on every part. And I think what I heard the chief say was a challenge to look. What happened? Like, we had this situation. What is going to happen along the whole process, from prosecution to trial to conviction? Or maybe it's not. Maybe it's a diversion, which happens. Okay, if it is prosecuted, it goes to the court can say, no, this isn't for us. We're going to divert to this other agency. It could happen. And, juvenile crimes are prosecuted locally. They're prosecuted by the Attorney General for the district. So what happened? And so those are questions that we have to ask. Legislation change, hearings happen. There was a hearing recently that I turned on, and the whole point of it was reimagining I can't even remember what it was called, but the whole point was we're reimagining child crimes, or young people that commit crime, or the child. Well, that's part of this discussion. So if you're rightly outraged right now, I challenge you to look at all parts of this system that aren't holding the whole ecosystem accountable, including us. Hold us accountable. If the police aren't doing it, or if it's DYRS isn't doing it, but we don't prosecute. It's not that's not part of our charge. We don't hold trials. That's not part of our charge. We don't even have complete supervision of juveniles. We want it, but that's up to the courts, the Superior Court. That's their charge. So there's a big part of this ecosystem that's important. And another part of it that we are responsible for is making sure that our children are engaged. That's why we've been so adamant about getting kids in school in person so that they can be around adults. Maybe that kid has some mental or behavioral health issue that needs to be addressed. We can better figure that out if they're in school. 13-year-olds should be in school. We are making sure that our recreation centers are activated and have activities. Even yesterday, when our schools had a professional day, we had our recreation centers activated so kids could be in an activity. That's important. We have credible messengers and violence interrupters that are assigned to different schools where we know we have issues. All of those things are critically important, but there have to be consequences. Okay, we'll take a few more. Janae?
How do you feel how the Attorney General's office is handling juvenile crimes?
What's that?
How do you feel the AG's office is handling juvenile crimes?
Well, I don't want to say without having a kind of a quick, up-to-date look back on some of the crimes that we're most concerned about. But I do know that there is kind of a philosophical shift to changing the way we think about juveniles in crimes. And I'm going to refresh myself on the hearing that the Committee on the Judiciary had, where the OAG testified about how that shift should happen. Somebody will remind me what the legislation is that the council is considering. But it's in front of the council now because I happened on a hearing about it recently.
All right, last question.
Can I go back to DC government employees? Do we know how many are yet to report their vaccine status?
I'm glad you asked it because it also gave me a reason to mention another point that I should highlight for context. So to answer your question, 1,500 out of the approximately 40,000 DC government employees have not notified us of their status. So when we begin discipline, it's impossible to simultaneously discipline everyone who's out of compliance. We do start with those who are the most out of compliance, which are individuals who haven't even told us their status. And on the other bookend, you might have someone who has one shot. They have to get 2 shots and a booster. We don't start with those individuals. We start with those who have not updated status. So there's a lot of attention that'll be placed on those who are out of compliance. But I do like to highlight that the vast majority of our workforce has embraced vaccination. And that's important not to get lost when you write stories. So include that with you. So I'm going to give you the data to make it easy. So 89% of DC government workers are fully vaccinated. DCPS teachers is 94%. Our fire EMS is up to 90%. MPD has 85%. So these are all, and we have obviously other agencies too. So just remember, like, as much as we were rightfully focused on those who just are holding out or refusing, 89%, almost 90% of our workforce didn't need any mandate. They got the vaccine and they've embraced its health benefits.
And all those fully vaccinated have the booster now as well?
With the one reason why managing it, we need a bit of time is we have to make sure our systems are set up to be able to flag when someone's timing hits and requires the booster. So it doesn't include the booster yet. We'll have that information as we approach the deadline.
All right, last question.
Thank you, everybody. Oh, Mark, yep.
Mayor Bowser, back to the 13-year-olds with the guns. Do you have any knowledge as to how these kids got guns, how 13-year-olds got a hold of guns? Do you know that?
I don't, but the chief is investigating, and I'm sure he can provide an update if they know yet the source of the guns.
And then one last question back to the vax mandate for restaurants and places. Have you decided whether you'll extend that to employees of these establishments as opposed to just the patrons?
We haven't revisited it, and I doubt that we'll be making any changes to it.
So what is the logic there that the customers have to be vaccinated, but the people who served them in the past, you had said it was because you were relying on the federal mandate, SCOTUS struck down. So what is the logic in having customers have to be vaccinated, but the employees who are serving them and preparing their food and drinks not have to be vaccinated?
Because the employers can, right now, require vaccination. They can, there's nothing stopping them. And so that establishment can require vaccination. So that is a level of involvement that we don't have to take because the employers can.
All right, thank you.
Thank you.